Hi, myself Dr. Shyam Sunder, Senior Spine Surgeon at Germanten Hospitals. Today, just I'm going to speak on a most commonly performed spine surgery called TLIF. TLIF, it's a fusion surgery. Basically, fusion surgery in the sense we are going to fuse two adjacent bones by putting pedicle screws, or sometimes we'll put other metallic implants. We'll try to fuse two adjacent vertebral bodies. So it's called fusion surgery. The TLIF means Transforaminal Lumbar Interbody Fusion. So we routinely perform this surgery with a technique called minimally invasive spine surgery. We won't open the spine like previous days. We put screws percutaneously, just making a small hole on the skin. Once we put the screws in under Shyam guidance, we'll open the skin only on the side, whichever the side more painful side, with the least damage to the muscles and the bone, and then we'll make the nerve free. After that, we'll insert a bone graft or a cage in between two vertebral bodies, and then we'll tighten the rods. So basically, this is very minimal access surgery and very commonly performed in specific conditions, like wherever there is instability because of the disc damage. There will be an excess mobility in between the bones, in between the vertebral bodies, that can give you instability. This instability will give you a lot of pain when patient is active, like when you stand, when you get up, when you walk, when you change your position, then it can give you the pain. So this pain will be addressed by doing a fusion procedure. So especially instability conditions, this procedure will be done. Second thing, when there is a significant narrowing of the disc space, there should be a minimum gap in between the vertebral bodies. If that gap goes down, there will be a compression on the nerve roots. To relieve the nerve compression on the nerve roots, we have to regain the height in between the vertebral bodies. So in that conditions, we'll do this procedure. Very rarely far lateral disc or extraforaminal disc, to get the disc which is out of the regular location, like central disc or a lateral disc, sometimes the disc will be out of the neural foramina, what we call is extraforaminal disc. In that cases also, to reach the disc, we have to remove the structure called pars. In that case also, to prevent further instability, we try to put the screws and cage and fuse the segment. So these are the main conditions in spine, very frequently done procedure in these cases. So this is a fusion surgery, very safe, very routinely done. No need to worry about the screws and all. The post-operative rehabilitation will be very smooth. Same day evening or next day morning, you can get up and go to the toilet. You can walk around with the belt. If you are doing a light job, you can go back to your job after 2 to 3 weeks of the post-operative period. If it is a heavy manual laborer job or manual involving lot of muscle activity and all, you can go back to your job after 6 to 8 weeks. So this is overall about the TLIF procedure. This will be done in both open and minimally invasive technique, and nowadays we are doing this procedure with minimally invasive technique with least damage to the structures. Thank you.